My cousin's name is Mallory, and she was diagnosed with a condition called Fragile X syndrome. She's now in her early 20s and doing incredibly well. My family benefited so greatly from seeing a genetic counselor as far as adjustment to this and how to move forward, and I wanted to do this ever since. I'm a genetic counselor, and genetic counselors are master's trained healthcare professionals with essentially equal training in both medical genetics and the science behind different types of disease, as well as the psychosocial counseling. In your first genetic counseling appointment, expect a lot of talking. The genetic counselor is going to collect your personal medical history as well as your family history. They use the information that they get from you and they perform as what is called a risk assessment. So what is the chance that the health conditions in your family might be linked to a particular gene, or specifically a problem in the gene, a spelling error called a mutation? And they'll share with you what those odds are and what testing might be available to you to help clarify whether or not you or your family members might be at risk of a genetic condition. They'll walk through kind of the ins and outs of the testing, what it can tell you, what it can't tell you, how long it will take, will insurance cover it, how will it impact other relatives. So for example, if you were to test positive, what would it mean for your siblings or for your children? And then what options would you have moving forward? And it's completely fine if you're number one, don't want the test at that time or don't want that test indefinitely. They're really there to listen to you and advocate for you as to what might be best for you moving forward. And then if you do choose to move forward, it's their job to walk you through that process, help coordinate the test for you, help explain the results for you, then help to get you connected with resources. And when you sit down with your practitioner or your counselor, it's their job to present you with all of the options and all of the different directions that you can go. In the area of cancer risk, it'll be discussing what those cancer risks could be for you, and then what are the different strategies that we have to manage those risks. And those generally fall into kind of a couple different branches. The first being doing more screening and surveillance to help identify a cancer earlier so that it's ideally more treatable or curable. There's also the options of prevention, where individuals can either take a medication or pursue a surgery to remove the at-risk tissue to be as aggressive as they can in reducing that possible risk. I don't feel that burying your head in the sand completely is the best option, as there's often tangible steps that somebody can take to change their life's course. Going to see a genetic counselor, it's not obligating you to a test, but it is obligating you to empower yourself with knowledge.